So the Bell is an exciting opportunity for the young people and their families diagnosed with cancer here at the Children's Hospital. We've brought the Bell here after some months of discussing with our families and the children about their own thoughts around the Bell and what it meant to them, what their experiences were ringing the bell in other centres. We contacted the charity run by Tracy and Phil Payton. Their daughter was diagnosed with a form of childhood cancer in 2003 and received treatment in Oklahoma, where they first came across the Bell. And as an outcome of that, they have made a collaboration with the Maria Watt Foundation, which supplies bells to, on a charitable basis, to many centres around the UK and indeed internationally. I believe they've supplied over 200 now, entirely charitable donated. For us, as clinicians, we see it as an opportunity to offer a symbol. It's seen as a symbol of hope for young people coming to the end of a phase of their journey, involving a variety of different types of cancer therapy.
We've come back from having received proton therapy in America, and Baillie got to ring a bell at the end of his treatment over there. So for us, it generated from Baillie wanting to have something to pass on to the other children coming behind him, going through treatment, and having simply something to say, yes, this is the end, there is hope.
In the Children's Hospital, there's a wide range of staff who are involved in the care of a child or a young person with cancer and their family, of course. So the journey can be very varied in length. It can be from 3 months to 3 years. It can involve treatments of chemotherapy, radiotherapy, surgery. So it's very different for every family, but it impacts emotionally on staff as well, because they get involved with the families, and that's quite difficult because sometimes the families move on to clinic out of the ward and you don't get to see them. So I think it's very significant that we have something to mark the end of the journey, that if a staff aren't on duty, whenever that patient finishes their journey, that they can have a video and see that happen. There's something permanent there to see the joy in that family's face, and ultimately then the joy for the staff as well when that journey has a good result.